Hello, my name is Dr. Christopher Riley, and I'm a board-certified surgeon based in Houston, Texas. And what I'd like to talk to you today about is the surgical treatment for type 2 diabetes. Now, type 2 diabetes is the type of diabetes that tends to develop a little bit later in life and is often associated with being overweight, or what we call obese. What most individuals know about type 2 diabetes is that there is difficulty in the body's ability to control blood sugar. Unfortunately, as diabetes progresses, also patients develop multiple complications, which can range from heart and blood vessel disease, which can lead to heart attacks and sometimes limb amputations. It can lead to eye disease and sometimes blindness, kidney disease, sometimes leading to dialysis, and multiple other complications associated with the type 2 diabetes and lack of control of blood sugar. Now, what also most patients will understand is that if you go to your doctor and you have type 2 diabetes, then they will usually start you with some medication, either some pills, and if it's difficult to control with pills, you'll advance up to insulin injections. What most individuals don't understand is that the recommended treatment for someone who is at least 100 pounds overweight and has type 2 diabetes is surgery. There are several surgical options. The one I'd like to talk to you about today is what's called the laparoscopic sleeve gastrectomy. Now, laparoscope is a small TV camera. The operation is done under general anesthesia, so you're completely asleep. Most patients don't remember or feel anything during the procedure. And the operation in skilled hands usually takes less than 30 minutes. And some patients actually even go home the same day. Now, what is done during a laparoscopic sleeve gastrectomy is that about 80 to 90% of the stomach is trimmed off, and you're left with a longer, skinnier, smaller volume stomach. Now, this does several things. One, it helps control your appetite, and eventually when you do get hungry and eat, because your stomach is so much smaller, you feel very full very quickly. So with appetite suppression and portion control, the laparoscopic sleeve gastrectomy helps you maintain a diet. Now, the weight loss is secondary to the diet that you're able to maintain, but it's much easier to sustain a diet when you have the help of the laparoscopic sleeve gastrectomy. What we do find is that if you lose your weight and you maintain that weight after the surgery, there's a significant incidence of resolution of your type 2 diabetes, which means your type 2 diabetes goes away and stays away as long as you maintain your weight loss. Now, I can't emphasize enough, this is a significant change in what we feel about the treatment of type 2 diabetes. You know, in the past, you would go to your doctor, you would get insulin shots, you'd get prescription refills for your tablets, but there was never really any way that someone could say, we can actually do something to get you off of your insulin, hopefully get you off of your pills. Now we do. Now we feel that with what we call bariatric surgery or weight loss surgery, you get the surgery, you lose your weight, you do your diet and exercise program, and you're successful with your weight loss, there's a very good chance your diabetes will go away, and hopefully you won't be on your insulin, hopefully you won't be on your tablets anymore. And that is the goal of most of my patients, and I've seen remarkable results quite quickly with weight loss surgery. So the message is, don't give up hope because you have type 2 diabetes. A lot of patients feel that once they have type 2 diabetes and that's it, they're type 2 diabetic and they're going to have all the complications that are associated with type 2 diabetes. Reality is there is an option. The option is bariatric surgery. Laparoscopic sleeve gastrectomy is a very, very good option. It is the most popular and most commonly performed weight loss surgery at this time. The results are very good. The risks are quite low. But when you consider that it is a surgery that can actually, in many cases, put into remission your type 2 diabetes, most patients will feel that it is a very good option to take, so that they don't have to hopefully take medications for the rest of their life, extend the quality of their life, hopefully medication free, and hopefully live a longer and more healthy life. Now, you can follow me on Facebook at Christopher L. Riley, or you can also follow at West Houston Surgical Associates on Facebook. If you have any questions or like to have a consultation, one-on-one consultation with me, my office number is 281-497-0296. Is West Houston Surgical Associates. Again, that number is 281-497-0296. Thank you very much.